This particular patient had a large burn wound on his foot. He sustained this wound after taking a too hot foot bath. He couldn't feel the temperature of the water due to his diabetic neuropathy. This wound also became severely infected, which is a common thing in large burn wounds. The biggest challenge in this case was that the patient had uncontrolled diabetes and the infection was really severe. There are many products known to wound care professionals that could help this or similar patients. But how do we choose which product will help your patient best?
Silver-based products have been in use for a long time already, but the downside of silver-containing materials is that it can be detrimental for the wound healing. Honey is an interesting compound because it's widely available, at least honey in its pure form. So we use skin, which is in excess from elective surgery like abdominoplasty, and we harvest a thin layer of skin and we make small burn wounds in those samples and infect those burn wound samples with Pseudomonas aeruginosa and then treat those samples with the different formulations. Antibacterial effects were that the L-mesitran performed equally well as the flamazine, so the silver-containing product, resulting in very low numbers of colony-forming units. Whereas in contrast, Medihoney product performed less well. There was a reduction, but it was much less. In terms of safety in wound healing, we looked at the regeneration of the epidermis. Most treatments performed reasonably well, and with the exception of Medihoney, where there was hardly any regeneration. L-mesitran had a good antibacterial effect, reducing bacterial numbers to zero, and the effect on wound healing was absent, so it's safe to use in burn wounds.
This study shows that L-mesitran performs the best compared to all the other products for treating burn wounds. And I'm honestly not surprised about this because we collect a lot of cases from nurses and wound care specialists that work with burn patients and use L-mesitran to treat their wounds. And there we see that it works really well.